Hi, I'm a registered nurse at My Houston Surgeons. This video is designed to inform you of generic and inherent built-in risks to surgery. Thank you for listening. There are inherent or built-in risks to any invasive procedure or surgery that you elect to undergo. Therefore, you must be informed of these possibilities and intervene when necessary to mitigate your risks. So before you sign up for this, you must be aware of these. Some of the associated risks include, but are not limited to, seromas, which are fluid collections, bleeding, or infection. Your provider may opt to give you antibiotics, run certain blood tests, or place drains in surgery to mitigate these risks. There are also risks of having delayed wound healing, wounds separating, skin loss, or other wound healing issues after surgery. Certain comorbidities such as diabetes, obesity, decreased protein levels, and smoking can increase your risk of having these things occur. Conversely, you may not be a smoker, diabetic, obese, or protein deficient, and still encounter wound healing issues. If this occurs post-operatively to you and you're concerned, please feel free to reach out to your healthcare provider so we can instruct you on proper wound care. You should also inform your healthcare provider of any current or past diagnosis of a DVT, which is a blood clot, bleeding disorders, smoking or use of nicotine-based products, and/or sleep apnea and the use of a CPAP machine. These are very important because they may require pre-operative intervention that can reduce your likelihood of experiencing post-operative complications. Additional risks associated with surgery are things like having a reaction to a medication you've never had before, IV-associated issues, post-operative nausea and vomiting, scarring, need for a revisionary procedure, or dissatisfaction with the outcome, damage to a deeper structure, shock, stroke, a fat or air embolism, or a cardiac or pulmonary issue. If you or your family have had any anesthesia-related issues in the past or you have concerns, it's important to relay those to both your operating physician and the anesthesia team. Although this video is designed to outline the major risks of electing to undergo an invasive procedure or surgery, your provider may give you additional or different information which is determined on a case-by-case basis. Of course, we encourage you to read through your pre-op paperwork to find out all about the specific risks inherent to your surgical procedure and ask questions when appropriate.